what is the most common thing that we hear parents tell teenagers? Sit up straight, stand up straight, put your shoulders back. Well, what if I told you this, folks out there? What if your child actually couldn't do that? The first thing you want to do is have them stand with their shirt off in front of you and look at their back. Do those muscles look symmetrical? Is that head on straight? Look at them from the side, from the front, and from the back. Take a 3-point view.
Look at the shoulder blades.
Yeah, that's not okay. So that's your child's body trying to compensate and move the head forward to fight a head rotation so it gets better vision. That vision is directly driving posture.
What are their feet doing too?
Yep.
Sometimes that's an easy one. Or like when you're watching them run, like what are their legs doing? What do you see like with their hips, or how are their shorts or their pants? Like where are those sitting on their body? Or if you always notice that they're walking off one side of their shoe.
Yeah.
All of them.
Everybody, welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and I am with the fabulous Dr. Julie Wyss, the BDC certified coach, Dr. Fairy Fingers herself, coming at them from where are we today, Dr. Julie?
We are in the Legacy Life Media Studios here in Green Bay.
Yes, we are. Again, our office, Prime Family Chiropractic Centers, evolves around families, involves children and pregnancies. That is our focus. Children, families, having them babies. So legacy life is one of the biggest things, is creating this longevity in life, right?
Absolutely.
And that's the point of this media studio. So if you know anybody that wants to do some recordings or come and hop in here with us on Legacy Life Media, reach out. We'd love to have you. Today, Dr. Julie, I want to talk about something kind of important.
Only something kind of important?
Just something, it's, I guess not. I guess it's the vital primary foundation of what we do every day.
Well, it sounds a little bit more important then.
So let me ask you a quick question. What is the biggest stress on our body every day?
I would say stress in general.
Stress in general, but the biggest one is gravity.
Yes.
And gravity is the most long-standing stress that our body will ever go through as soon as we start to walk. And from that point forward, we have gravity pulling down on just our legs. And that causes and can cause postural distortion. Changes in how we're sitting, changes in how we're standing, especially in the pediatric world. This is when children are always yelled at, right? From basically 5 years old on, what is the biggest thing parents say to their kids?
Stand up straight.
Stand up straight.
Sit up straight.
Sit up straight.
Like now everybody is so consumed on tablets and phones that it's like, I'm surprised that we aren't like losing people's heads, right?
Right.
But when we look at, gosh, like how smart and how capable our body is, like my analogy, because I am so visual, it's like if we have a pool noodle and we're attaching a bowling ball to the top of that.
Oh, wow.
Right?
Yeah.
You can only hold that for so long. Well, that's what our bodies are doing. And I'm assuming that we're going to be talking about kids and like we have gravity, but all the other stressors that we're adding on to our bodies and every day, it's pretty alarming.
Exactly. We're talking posture. This is where we're going. And you're exactly correct. It's that changing, it's that balancing of that 12 to 15 pound weight bowling ball on top of a golf tee or a pool noodle, like you like to say. And actually, that's a great analogy, because a pool noodle is what their body's like those first basically 3 to 5 years of life. You know, you think about when a baby's born, they don't have a lot of strength. They're bobblehead. They're wobbling all around. They're doing the shuffle and the shake, trying to constantly balance their body because they don't know if they're supposed to be on their stomach. They don't know if they need to be upright. And the reason why children are so wobbly, floppy-headed in the beginning is because they just came from a water environment. So there was literally no gravity pulling down on them. And they were very, very buoyant. So they have tone, but they don't have stabilizing tone yet. And as soon as they're born, all those stabilizers kick in. And so when we have a baby, so let's start newborn first, they'll get kind of floppy and be kind of wobbly back and forth. They'll do the old head thing where they pull back, they extend. Dr. Julie, when you're dealing with moms, and we're working with moms and dads with holding those babies first, because we know posture starts when they're little. like when they're
Absolutely.
first born.
Mm-hmm.
And that's an alignment of that first vertebra in their neck and their skull. What's some of the best ways to hold a baby when they're first born?
Well, I'm making sure that we're not picking them up by the shoulders, right? Because that head is going to be bopping all over.
Mm-hmm.
And it's similar to getting, like, as an adult, having whiplash,
Yep.
right? So we really just need to make sure that we're always supporting the baby's head. So if
Yes.
we're holding it, if it's in the nook of our arm, if we're, if they're laying across our arm, if they're on their tummy, of supporting that chin, if we're baby wearing, making sure that we have that support to keep that head up, because they don't have the strength, they don't have the musculature to support that. Like, that's a heavy head
Yes, it
for the
is.
size of that
Yes,
baby's
it
body,
is. Yes, it
right?
is.
Right. So we definitely just need to make sure that we're cognizant of that. We're always supporting that head when we go to pick up from off of the table,
Mm-hmm.
or out of the crib. That we're supporting that neck, we're holding that head, and keeping it close to our body.
Even if the parents have noticed that the child, since they were born, are able to hold their head unassisted, you always want to make sure you have your hand by their neck so they don't do the extension thing. Like, they have a Moro's reflex from 0 to 6 months old, which makes them extend, right? We've talked about that in neurological development before, but that also makes them click their head back, if you can see that. And so we want to make sure we got our hand on that. And then the other thing too that I'd like to mention is that when we're holding our babies, if we're going to hold them left-sided for a while, we want to hold them right-sided as well, so we don't give them a tendency to always lean their head to the left or lean their head to the right. So alternating those sides, that can be fairly tricky from a parenting perspective, because if you're right-handed, you will have a tendency to hold your baby in your left arm.
Yep. And I was going to say, maybe we'll get to this, but baby may only like one side over the other side,
Mm-hmm.
right? So then that's where the chiropractic comes in. That if,
That's indicative.
like, we talk about that when we're breastfeeding,
Mm-hmm.
right? That baby's only comfortable on one side. But if we're trying to crisscross or hold our baby on each side and baby's head doesn't turn, right?
Mm-hmm.
That should be a red flag of, well, why is my baby only like that one side?
Mm-hmm.
Well, because it's causing discomfort to be able to turn the baby's head.
Yep. So like you said, breastfeeding and then holding them. That's awesome point. So now let's transition now into them going from flipping over, crawling, to now walking. And the crawling phase is a total different podcast, talking about all of the components there for stabilization. They should be 6-point crawling. We can touch on it just really briefly. They shouldn't be army crawling. They shouldn't be gorilla crawling, which is just on their hands and toes and not letting their knees hit the ground.
Yep. So like, people are counting like 6. Like, wait a second, that's my hands and my knees, but it's hand, knees, and your feet.
Yeah, we like to call it 6-point crawling here at Prime Family Chiropractic Centers, or normal cross crawl, right? They shouldn't be rolling, butt scooting, all of that. That's all signs that we don't have the right communication between the brain and the body, and that directly will affect how their body heals from that point forward. It will affect their health.
It's the miscommunication, right? It's the misfire. If you're a car person, it's the misfire in the engine. If you're a computer person, it's a computer virus, or the Norton software, right, is engaging someplace, or it's not engaging. It's the electrician, right, where if there's a fuse box, a switch. So, like, sometimes we use language and some people don't understand, like, well, I don't understand that. Basically, we can say this however we need to say it in whatever industry that you understand. But bottom line being, baby isn't growing and developing like it should, and there's something malfunctioning.
Right. So those are signs that you can be watching for. Now, when they start going into walking and moving themselves around, pulling themselves up on furniture, now is when balance and posture really comes into play, because that first 2 years of life, they get 80% of their head growth, they get 80% of their skull growth. They're actually really out of proportion. Their head is not proportionate to their body. Their head's actually bigger. Your body fills out proportion when they get into their teens. So when we start learning how to balance and walk, that communication between their brain and their body is absolutely vital. Because if I said to you, Dr. Julie, balance versus posture and stability, but if I actually use the word balance to you, what is the first thing that comes to mind? Is it muscles or is it nervous system?
I think traditionally people are thinking muscles.
Right. Exactly. But what controls those muscles?
The nervous system.
The nervous system. Exactly. So like that communication is vital. So if we've got muscles that are overdeveloping or underdeveloping, they should be balanced from side to side. They should be developing at the same size from side to side. People will often say, well, if they're right-handed, they will get all of this right-sided development. But the thing is that when we actually go and test that on children, we will find that that overdeveloped side is actually weaker than the non-dominant side, which is not okay.
This is a fun thing that we do with our adults, right?
Mm-hmm.
So if you're an adult, you're listening to this, take a little tape measure, and if you're right-handed, like think about it, your right bicep should potentially be larger, right? We're thinking
Mm-hmm.
dominant, that we're using
Mm-hmm.
it all the time, should be larger than the left side. So why don't you just do
Exactly.
that measurement first,
Same
and then
thing.
we can come back and chat.
Same
thing
thing with
our,
the quad. I
yep,
mean, the thigh
and
meat.
thighs.
Same thing with the calf meat. Like it all should be bigger on the dominant
Mhm.
side, but usually it's not. So we're getting wear down and atrophy, and that's coming from a problem with your balance and your coordination.
And usually attributed back to childhood.
Yes,
This
it
isn't
is.
something that as an adult that like, oh, I just need to go to the gym more.
Mm-hmm.
You can go to the gym and work out all that you want,
Mm-hmm.
right? But there's still going to be that discrepancy because, again, that muscle isn't getting the information.
Mm-hmm.
Why we're talking about kids, of why it's so vitally important to have that right communication.
And those postural deviations. So now when we come back to the comment we made earlier, what is the most common thing that we hear parents tell teenagers? Sit up straight, stand up straight, put your shoulders back. Well, what if I told you this, folks out there? What if your child actually couldn't do that? What if they physically could not stand up straight? Can you stand up straight? If you try to stand up straight as an adult, does it hurt you? I bet every one of you out there, if you're listening to this right now, and even if you're driving in your car, try to sit up straight once. Try to bring your head back over your shoulders. Try to roll your shoulders back, and then try to put a little bit of dimple in your low back. I can guarantee you within 60 seconds, it's going to start to hurt.
Or you're going to get tired.
Or you're going to get tired. And that is called normal posture, to be able to sit upright over your center of gravity, shoulders back, head back over your shoulders, and to sit there. But most of you will find that extremely uncomfortable. So why would your children want to sit up in that direction either? The reason why it's uncomfortable is because those muscles are not used to stabilizing you in that position. Your body, your spine, has taken a posture on of super straight in certain areas and extra curved in other areas, which then causes pain if you try to sit up straight. So what if you physiologically can't? What if you neurologically can't? Something to think about. Like we talk to our children about that all the time. All of us do. Sit up straight. Put your shoulders back. Put your head back. You always look like this. You look.
Or lift your head up.
Lift
right?
your head up. You look like a turtle. You know, in fact, back in the 50s and 60s, they made you walk with books on your head, right? They wanted to go over posture with these ladies. Some of you may think that that was kind of sexist and chauvinistic and things like that, but it was actually driving normal communication to work those postural muscles. But those postural muscles are controlled by the brain. So if we don't have right communication to the body, your posture is going to distort itself to fight gravity, to keep you upright, to try to fight your head tilt. In fact, if you have a child out there, since we're talking about posture, the first thing you want to do is have them stand with their shirt off in front of you and look at their back. Do those muscles look symmetrical? Is that head on straight?
Mm-hmm.
Look at them from the side, from the front, and from the back. Take a 3-point view.
Look at the shoulder blades.
Yeah,
right?
look at
Or
the
look
exactly.
at the clavicles, the bones in the front.
Yep. And what is one of the biggest things that you always talk to our parents about? You talk to them about head tilt a lot, right? And how is the head tilting? Is the kid's head on straight, or are they kind of tilted off to the right or tilted off to the
Or
left?
even rotated, right? When they
Mhm.
say, okay, look straight ahead. If they're looking this way, right, but maybe their eyes are a different direction.
Mhm.
So it's we need to be looking at all of those things: the ears, over the shoulders, nose,
Mhm.
center, midline.
And what you'll notice sometimes is that, not to get all neurology and nerdy on you, but the dominant side, the dominant eye, will always face itself forward slightly. That's not actually okay. That's a compensative response, not an adaptive response. That's not okay. So that's your child's body trying to compensate and move the head forward to fight a head rotation so it gets better vision. That vision is directly driving posture. It's directly driving posture, and that postural reflex starts when they learn how to start to crawl, lay on their tummy, and put their head up.
Well, hey, like we always say, like our bodies are amazing. They're so
Mhm.
smart, and everything is. I'm gonna say it. compensatory.
Yeah.
Right. So everything compensates. So if as a child, if we're not crawling correctly or we have that miscommunication, our body isn't just gonna like stop and just be done with everything. It's going to compensate. And so that's where it starts to like starts changing and changing and changing. And before we know it, like that's where the measurements are off. And that's why all of a sudden we have this like really crazy head tilt, or maybe vision is really off, that we need to have surgery or, vision training, when all of this could be dealt with
when they're little,
at an infancy stage.
Yeah, infancy stage, or even during pregnancy, right? But these postural things are what parents look at all the time. So if you find yourself out there that you're constantly telling your child or your spouse to sit up straight, don't stand with your shoulders rounded, and hey, you've noticed this with me sometimes, like when I'm talking in public or up in front of people, I'm hunched forward a lot. I don't try to be. That's the posture that my body's taking on right now when I'm misaligned, subluxated, and don't have the right communication. I will always stand up taller. And if you're in a job where you're always hunched forward, you need to take time to work those postural muscles. But the most important thing is to have that nervous system talking properly to those postural muscles.
Communication, not back talk.
No back talk, because back talk leads to what? Frustration, meanness. I don't like muscles being mean. I don't like people being frustrated. Miscommunication, right? Not a good thing. So with our teenagers, what we will see is that they will have a lot of anterior head tilt. And we're going to talk about that in our next episode, literally what it's like when these kids have the big word called text neck, and what do we have to do to help that out, because it all starts when they're little. But when we're putting devices in front of children, we're going to get into that next episode. It's not a good thing. Now, when we're talking posture as well in adults, which we will see, poor posture will lead into adulthood, right? So as we get older and as we get into our 20s, 30s, and 40s, because we reach full spinal maturity at what age? 22 years old. Full mental maturity at 25. So in your early 20s and mid 20s, that's when everything is finally acting like it's supposed to as an adult. So that's when a lot of these compensations and these changes in posture will really set in and ingrain themselves. And then they become learned neuromotor habit. Learned habit. So now we're trying to fight habit all day.
And it's a habit. It can also be change. We can learn new and better habits. But man, if it's 20 years of learning that bad habit, it's not going to just change overnight. That's where you have to insert a snap, right, for me.
Right.
It's not going to change overnight. So we need to retrain the body, and that's the repetition.
Yeah,
right?
in the chiropractic adjustments.
Over and over and over, because again, we need to tell the body, okay, I don't want to do this anymore. We need to learn this. And we can't just do it whenever we think that we need it.
Yep.
It's the repetition and learning this new and better habit.
Well, they will need some exercises to help with that.
Yeah.
But we want to make sure that the neurology is intact, talking to the muscles appropriately.
So that if we're doing the exercises, right, things will happen.
Well, exactly. And there's been this long thing of always saying that chiropractors and physical therapists are at war with each other, or MDs and chiros are at war with each other. And that's 100% false. We're not medical doctors. We're not physical therapists. We're chiropractors. When we need postural stabilizing exercises, guess who's really good at doing those? Physical therapists. Guess who's really good at restoring normal nerve communication between the brain and the body and the body and the brain? Chiropractors. Physical therapists don't do that.
Together, how much quicker could these things be resolved?
Exactly. And I love working with good therapists, with other good chiropractors, other good physical therapists, other good occupational therapists that can help give children exercises to help promote their posture, promote themselves being healthier and upright, versus just saying that we're at competition and that we don't work well together. I love working with physical therapists that want to work with us and not against us.
Absolutely.
Absolutely. And that's what we do as chiropractors. And that's how working these postural stabilizers in your kids and changing their posture. So remember, things you can watch for at home: head tilt, head rotation. Are their shoulders balanced? Are their hips balanced? And are their legs balanced?
Yeah,
and if they're not,
what are their feet doing too? Sometimes that's an easy one. Or like when you're watching them run, like what are their legs doing? What do you see like with their hips, or how are their shorts or their pants? Like where are those sitting on their body? Or if you always notice that they're walking off one side of their shoe. all of these things.
Well, all of those things are huge, but those are major points that parents those are things that you at home, parents, that you can be using on a daily basis or monthly basis, checking in on their kids. Head tilt, head rotation. So are they looking right or left? Are they tilted right or left? Are their shoulders balanced? Are their hips balanced? Are their shoulder blades balanced? And do their feet point in and out? Those are just little things that you can notice on your children, that if you notice any of those postural deviations, any of those balance problems, they should be checked by a chiropractor. 100% have their nervous systems checked to make sure that they're posturally balanced. 100%. The body leaves clues, right?
Absolutely.
It 100% leaves clues. So know what those clues are, how to check for them, and are they out there? Dr. Julie, do you have anything else you want to add in today about posture in our kiddos?
No, that's it.
Nope. All right. So go out there, get it done. Give us a like below and share this to as many people as you possibly can, because Dr. Julie and I are on a mission to get out to as many people across this United States and this world to help them get their kids to more chiropractors and get their families under chiropractic care. So take care, everybody. Have a great day. We'll see you all next week. Bye, everyone.